First of all, how do you cut open the skull?
Brain tumor surgery has advanced over a period of many decades and years till very recently. What we used to do is, as I told you, there's a layer between the bone and the brain. Dura matter. We make small holes using drills or using braces, and we reach up to the dura matter, and then we pass a guide between the bone and the dura matter.
There's a gap between.
There's a gap. We create a gap without damaging the brain. We create a gap between the bone. It can be easily stripped off the bone. On that guide, which is like safety, we pass something like a saw, like a tooth saw, and then we cut between these two openings. We saw the bone. So we have to saw it in 4 directions so that it becomes a free flap. Like if you want to cut, we put 4 holes and then we connect the holes with the saw, and then they used to remove the skull. And based on where the tumor is, or based on where the whatever hematoma blood is, we fashion a bone opening called a craniotomy. So earlier I told you they used to use this saw, but now it is advanced. We have drills which will rotate at a very high rate, 75,000 RPM. They create a opening, and there is a special cutter which will cut only on the bone above the dura, and then you connect all around
at that precision.
Yeah, and you remove that part. After that, you open the covering of the brain, that is the dura matter. Brain is totally painless.
No sense organs there.
No
right?
sense of pain, no sense of touch on the brain. That's how you can do awake surgeries. You give anesthesia on the scalp so that the patient does not appreciate the pain when you are cutting the skin. And you give little more pain of anesthesia when you are cutting the bone. Some pain will be there. After you open the dura, totally painless. What we say, the patient becomes more light. This kind of surgery is very important when you are operating on, as I told you, on these eloquent areas. Speech area, hand movement area, vision area, speech understanding area. Suppose you try to remove it, you're too aggressive to try to remove the tumor. You may cause more damage because that person can have paralysis or weakness on the other side. So when the person is awake, one a neurologist or neurosurgeon can talk to that person and say, move your hand.
Oh, right. And I've seen pictures where patient has playing guitar, right?
Yes. People have been writing, playing the guitar, playing flute. When the patient is weak, suddenly speech becomes little. When he says he's a Clinton, then you know you're near the. So you have to stop. You can't go beyond that because you have to weigh the risks and benefits. Risk of removing that lesion and giving him lot of weakness, deficits.
Is it worth it?
And you have to balance everything and then do the surgery.